joined here by Kim Knight. Kim, you're known as the Kiwi Health Detective.
Yes.
Can you explain it a bit more to us? What does that mean and what do you do?
What I do is I help people to actually identify and understand the absolute root cause of their illness at a fundamental level, which goes far deeper than what most people believe. Most people are looking for a physical cause to a physical problem. Actually, we find that the cause is more at a metaphysical level, and that's not a woo-woo term. Meta just means beyond. So we're looking at what are the other factors that have contributed to symptoms building up. And one of the big factors is actually emotions.
Oh, right, okay. And so tell me a bit more about your work.
So I work mainly with people who've been diagnosed with a chronic illness like fibromyalgia, chronic fatigue, irritable bowel, also anxiety, depression. And often they have been to many therapists and doctors and specialists, and they've had all sorts of tests and nothing has come up. And so the practitioners are quite baffled because the person is quite obviously experiencing, massive symptoms, but nothing is showing up in the tests. And that is because they've been looking for a physical cause to a non-physical cause.
Yeah, and quite often we try to put a label on something but if the tests come back normal, that's sort of what do you label that with? And it's often what the patients are trying to find is that label or some sort of answer, isn't it? Yeah.
We can actually get misled by labeling things. I tend to not put a focus on that. I remember once, it was one of my first patients actually, or I actually call them clients, came to me. She was 75 years old and she'd been in hospital for 3 months having test after test for excruciating abdominal pain. Which they felt was, somewhere in the colon. And during our second session, what came up for her was a memory of her mother dying. And her mother was in hospital. She visited her one day, said, "Okay, I'll see you tomorrow, Mum." Came back the next day and her mother had died overnight. And she just didn't know how to process that sadness. Well, interestingly enough, in Chinese medicine, sadness is an emotion that gets stored in the lungs and the large intestine, which are a paired organ. And what we discovered was that literally the energy, because emotions are emotion, they are energy and they should be in motion, but they get stuck. And our digestive tract actually has to digest our emotional life. Physically, it has to digest our food and water. That's a physical function of the digestive system. But every cell and organ and tissue in the body also has a metaphysical function. And so the metaphysical function of the digestive tract from the mouth to the anus is to process and digest our emotional life, and in particular our emotions. So this sadness had literally got lodged in her large intestine energetically. She hadn't been able to let it go. And of course the metaphysical function of the large intestine is to let go of what we don't need. So she had a huge sort of emotional release, a huge recognition, conscious recognition, recognition of that sadness, and the pain just went immediately.
Okay, so sort of walk me through your typical day. So say a patient turns up to see you, how do you go about, you talked to me earlier about a 90-minute session or something along those lines. Can you explain to us about what you would do, what a person would expect when they came to see you?
Well, out of interest, when I started working, people did come to see me. Now, I see 100% of clients remotely, because most people are in other countries or somewhere else, in New Zealand. So it's all online now. So we use Zoom or Skype to connect with.
This is a video interaction or like a visual kind of interaction?
Absolutely. I mean, I can do it. We do it sometimes by phone. Sometimes people don't have Skype, or phone or Skype with the visual, so audio visual. And basically what I do in the first session, which is just a sort of a signature technique that I've developed over the years, is I look at their whole life literally from the moment they're born until now. And what I've noticed is that there are certain key events that happened in a person's life that create a stress or a shock moment, which is known as a Yudin. And a Yudin is an unexpected, dramatic, isolating no strategy shock. And when that shock happens in a person's body, it registers in the heart, then it also registers in a certain place of the brain, and then it also gets transmitted to a certain organ or tissue, and that energetic shock and trauma is actually held in the tissues until it can be dealt with. So normally what has happened is, and this, what I found is this always happens by the age of 10.
Yeah.
You could say by the age of 7, but I sort of, just to be safe, I say, okay, by the age of 10, what events have happened in that person's life that have either been emotionally traumatic or very stressful and led that person to be perpetually in the stress, fight, flight, sympathetic nervous system response. They don't know that because it becomes so habitual. So for example, if somebody is living in a family where the parents are always arguing, that's a very scary situation to be in for a child. And so they're perpetually on eggshells. When's the next argument going to happen? When am I going to be punished again? When am I going to be criticized again? And they get locked into this stress response, and then they stay in it for years. And of course the body is not designed to work properly when it's in the stress response all the time. So what we do in this first session is I'm looking for certain key events that have happened in that person's life, and there are definitely recurring themes of whatever has happened in the first 7 years, and a major theme actually is abuse, mistreatment, bullying at school, bullying at home, a very, very big theme. But of course the actual physical symptoms don't turn up until later in life. And the reason those symptoms do turn up later in life is that the person has been afraid to be their authentic self. So they're not being true to themselves, they're not speaking their truth, they're not stopping that unfair behavior, they're not communicating how they honestly feel, and they're not looking after themselves. They're doing everything for everyone else, but not for themselves. So these are the sort of patterns of behavior that I'm looking for in this first session. And it's like getting pieces of the jigsaw puzzle, and then by the end of the 90 minutes, we have many different pieces of the jigsaw puzzle, and more to the point, they have the understanding because they need to understand what's happened.
I can imagine it'd be quite complex as well. Like sometimes 90 minutes might not be long enough to have quite
No,
a
it
few
actually
sessions.
is.
It is?
It
Okay.
absolutely is. I know exactly what questions to ask, and people just reveal it. The information just comes out, and it's like, oh yeah, that happened to me, and oh yeah, that happened to me, or I'll say, what else happened? What comes to mind? And it's always the right things come up at the right time. So I've never not been able to do it in 90 minutes.
And how do people find you? Are you is it GPs that are referring or
I would love it if GPs were referring. In fact, one of the methods that I use, which is called Mickle therapy, was developed by a medical doctor in the UK, and it was specifically developed for chronic fatigue, fibromyalgia, irritable bowel, anxiety, depression, post-viral fatigue, glandular fever, these chronic pain and fatigue conditions. But it's still not that well known. Thousands of people have recovered their health using, the principles and the techniques, but it's still not that well known. But as far as how people find me, the internet. It's all internet.
Yeah. Okay. Now let's talk about you being here today at this conference. So you've been to a few technological conferences this year, and you've come in today. And what are you doing? What's your interest in the HINS conference?
Well, I'm interested. What initially drew me to these conferences, I went to the Healthcare Congress earlier this year, then the Cloud in Health Symposium a few months ago, and now HINS, is initially it was like, my whole business now is online. It uses technology. It went from seeing people in person to everything online, from a point of view of the one-to-one clients, but also the online group webinars, multi-speaker online summits, and now home study online programs. So my whole business is online, and it's funny because I didn't consciously choose that. It just sort of happened to evolve into that. But so there's a technology aspect. I'm always interested in keeping up with the play, and I think there are just amazing advancements in technology that blow my mind, and it's very fascinating. But the one thing that I've noticed in all three conferences as a theme, which I don't think is being addressed, is that all this technology is really progressing at an incredible rate, but the understanding of the fundamental cause of illness is not. So the same solutions, if you like, are being applied just with newer technology, but the fundamental understanding of what creates illness and how patients are dealing with their illness is staying the same. So I can't remember the exact quote, but Jonathan Coleman this morning mentioned, it's our role, it's our moral right as a government to give the best healthcare to our citizens. and support them as best as we can. But still he was referring to, okay, well, they will be given their medication and they will be monitored remotely, and this is like the future of healthcare. And my standpoint is no, what we need to be doing is educating people, really educating people. What is it that creates illness? How is illness created? So that people can understand why they become ill and then reverse the symptoms themselves, which is in many cases very possible. And then of course then that moves into prevention, because once we know how to reverse the illness, then we know what to not do again to get ill again. And for me, that's what I had to learn. I was ill for 10 years. I was unable to work, well, more actually, 20 years, but unable to work for 10 years. And so I had to learn at a fundamental level, what was it that led me to be ill, and what is it I no longer can do, and what, in the words of one of my teachers, what damage are you doing to your body that you no longer need to do in order to not get the result that your body is showing up, because the body is far too intelligent to make mistakes. Illness is not a mistake. It's the body's way of saying you need to pay attention, you need to deal with something, you need to behave differently and do differently. And if you do that, then your body will show a different result. In other words, it will show health instead of dis-ease.
Okay. So what you're saying is things haven't really changed from the pathological viewpoint of how we manage health, but we've got all this new technology that's coming in, and it isn't really sort of marrying it up together.
That's right.
Yeah. Okay.
And I think one of the major things is that they keep on looking for a physical cause to a non-physical cause. Like the lady that I said, there were tests in hospital for 3 months, found absolutely nothing at a physical level because it was energetic. And quantum physics and people like Dr. Bruce Lipton have proven unequivocally that everything is energy. Even solid matter like this, if you put it under a microscope, magnified 1,000,000 times, it will look like more space than matter. We are energy beings, and it is not woo-woo, this is science. So our thoughts are energy, our emotions are energy, our physical body is matter, but it's actually energy. And this is the Chinese medicine talk about this a lot, energy can either be blocked or it can flow. And when people get ill, their energy is not flowing.
And of course, we've got that large gap with health literacy as well, people understanding what's going on with themselves.
It's education, and it is awareness. People have to become aware of what they were previously unaware of. And the problem is we're not aware of what we're not aware of.
Exactly.
And that's why, but as soon as people have, for example, this first session, they go, oh my God, it makes so much sense. That's one of the most common things I hear. It's like, oh my God, it makes so much sense. It's not rocket science. I just hadn't recognized it. And the word recognize is recognize.
Recognize. Oh yeah, that's clever. Did you come up with that yourself, or?
No, well, I became aware of it one day.
Right. Okay. All right. Kim, how do we find you if we want to get in touch with you? How do we? You said the internet, but how do we find you?
Sure. So KimKnightHealth.com is the easiest way to go.
KimKnightHealth.com.
Yes.
Okay. All right. And we just enter into there and go from there.
Yes. And I interact mainly on Facebook, I would say. Not a great LinkedIn or Twitter person. Also a lot on YouTube.
Okay. Well, it's lovely to meet you. Thank you for coming along.
Thank you so much.
Enjoy the conference.
Thank you. Thank you.